Mr. President, on March 10th, this body, the United States Senate, passed legislation to address what is a growing problem in all of our communities, and that's the heroin and prescription drug epidemic. On March 10th, this body voted for a comprehensive bill called CARA, the Comprehensive Addiction and Recovery Act. It deals with prevention, treatment, recovery, helping our law enforcement, getting prescription drugs off the shelves of our bathrooms so that it's not being used to get people into this addiction, helping to stop the overprescribing with a drug monitoring program. This was a comprehensive approach that was intended to help our communities back home to be able to deal with this growing problem. Number one cause of death now in my home state of Ohio is not car accidents anymore. It's overdoses. It's overdoses from prescription drugs and heroin. Since March 10th, I will tell you, I have come to the floor now 4 times. This is the 5th time. Every week we've been in session since then to urge the House to act quickly on CARA. Because with a 94-to-1 vote, with that kind of consensus built around this place, which is highly unusual, it shows that this is a problem in all of our communities and all of our states. We spent 3 years putting together the legislation. We worked with experts from all around the country. We sought out best practices. This is just not a matter of throwing more money at a problem. This is a matter of taking the resources here in Washington and spending them more wisely, targeting them toward what we know works, toward evidence-based programs in prevention, treatment, recovery that actually have shown promise to be able to begin to turn the tide on this horrible epidemic. The House has begun to act, and I am encouraged by that. Obviously, I wish they had taken up CARA right away, sent it to the President. I think it would have been already helping in our communities in significant ways. During the time between when the Senate acted and now, March 10th to now, by the way, we've lost 7,400 Americans to drug overdoses. We lose a fellow citizen every 12 minutes on average. But the House is moving, and yesterday the House passed legislation in the form of over a dozen different bills, smaller bills, that will help with regard to this problem that I think are steps in the right direction. Today, they're planning to take up a more comprehensive bill, the CARA legislation, that has also been reported out of the Judiciary Committee, as it was in this body, and perhaps a couple of other bills as well. I'm told that vote is likely to occur today, and that's great. I am concerned that the legislation that's passed in the House still leaves some gaps, and those gaps are in some significant areas. I'm hopeful that some amendments will be adopted today that help to fill some of those gaps so that we can indeed have a comprehensive approach to this issue. Sadly, this issue is not getting better, it's getting worse. The U.S. Drug Enforcement Administration just last week conducted their National Drug Prescription Take-Back Day. This is where you take drugs off the shelf and put them into a disposal unit to get rid of them so that your kid or grandkid or somebody visiting your home doesn't get these prescription drugs and misuse them. They had a record number of drugs turned in, 893,000 pounds of unwanted medicine. That's 447 tons of prescription drugs that were not needed. I'm grateful for those who participated in the Take Back program. This is good news to get these drugs, again, off the shelves and be sure they're not being misused. But unfortunately, of course, that's just the tip of the iceberg, and it shows the severity of this problem. We've continued to see throughout my state and throughout the country communities that are being torn apart by this issue, families that are being devastated. Last week, a man pled guilty to involuntary manslaughter in Columbus, Ohio, because his infant son had ingested fentanyl-laced heroin and died. Last week, we also saw the arrest of 3 people who drove to Steubenville, Ohio, to buy heroin, and then while driving, they used it in the car with a 4-year-old in the car with them. This all happened in the last week. Last week, a 23-year-old pregnant woman and her unborn child were found dead of an apparent overdose in New Carlisle, Ohio. Yesterday, an Akron man pled guilty to selling heroin to his uncle, who subsequently died of an overdose. In Cleveland, we've lost 148 people to drug overdoses in just the first quarter of this year. That's double last year's rate in Cleveland, Ohio, one town in one state. The plurality of these deaths, by the way, the majority of them were from fentanyl, and fentanyl often laced with heroin. Fentanyl is a synthetic heroin. It's about 50 times more dangerous. It's a growing problem in my state of Ohio. Unfortunately, again, these headlines are just the tip of the iceberg. We do see this death toll rising, and it's tragic. But we also need to focus on the wounded. Not just those who overdose, but those, because they have this addiction, have lost their job, cannot get their lives back together, are separated from their families. As one recovering addict told me, the drug was everything. I abandoned my kids, my wife. These are people also who are ending up in our jail system. Prosecutors back home tell me the majority of the crime. One county prosecutor told me a couple weeks ago, 80% of the crime in his county is being committed because of this issue. So, theft, stealing in order to pay for a habit, ending up in the prison system. All of us are paying for that, of course. Everywhere I go in Ohio, people tell me about how this epidemic is affecting them. I had a town hall meeting week before last, teletown hall, 25,000 people on the phone call. We do these once a month. And a gentleman called in and he wanted to talk about the CARA legislation. He seemed to know a lot about it and he focused on the treatment part of it. His voice had a quiver. And so I asked him, I said, would you mind sharing, and you're on the line with a lot of other people, but would you mind sharing why you're so interested in this issue? Again, he was focused a lot on the treatment side. And there was silence on the other line, and I knew what he was going to say. And when he came to the point where he could speak, he said, I lost my daughter. And then he proceeded to tell the story. And it was of a child who had started with prescription drugs, ended up with heroin, had committed some crimes, probably theft, ended up in prison, he said, in and out. She had finally come to the point where she was willing to face up to her addiction. She was ready to go into treatment, to start long-term recovery. She had committed to it, to her parents. He said they took her to the treatment center. There was a 14-day wait. They pleaded, can she get in someplace else? No. No room at the inn. 14-day wait. During those 14 days, of course, is when she overdosed on heroin. His point was very simple. You guys need to do more to help provide access to treatment and the right kind of treatment, and that's what this legislation does. Last Tuesday, I spoke at an opiate conference in Ohio. It's the Ohio Association of County Behavioral Health Authorities. It's an annual meeting, record attendance this year, over 1,000 people. I heard from doctors, nurses, counselors, social workers, attorneys, law enforcement, all saying the same thing to me, which is, Rob, this problem's not getting better, it's getting worse. And Washington does have a role to play, to be a better partner with state and local government and with the nonprofits that are in the trenches dealing with this issue every day. The Kaiser Family Foundation last week released a survey that showed that 44% of the public, 44%, knew someone who struggled with addiction to opioids. Of those 44%, 1 in 5 said it was a family member. 1 in 5 said it was a close friend. 1 in 5 said it was an acquaintance. 2/3 overall said they want the federal government and state government to do more about this addiction epidemic. Of course they do. People are desperate to figure out, how do you get at this issue? And again, our approach is evidence-based. It's based on the testimony of the experts around the country. It's based on best practices, what's working, what's not working. Is Washington going to solve this problem? No. But we're part of the solution. It's going to be solved in our communities, in our families. We can turn this tide. We have in the past. We can do it again. The question is whether we're serious about it, whether we can move this legislation through the House, through the Senate, get it to the President, and get it working in our communities. In countless parts of Ohio, at the state and local level, people are taking action, and I am encouraged by that, and I applaud them for it. In my hometown of Cincinnati, the police force at the University of Cincinnati is now carrying Narcan and getting the training to know how to use it. By the way, that's in this legislation, to provide that training to ensure that people aren't just getting naloxone, they know how to use it. This is a miracle drug called Narcan or naloxone that when someone has overdosed, to be able to bring them back. And I've been in drug treatment centers all over my state, and I've heard the testimony, including a man who told me I died. I faced my own death. I saw my father in heaven. I was gone. Narcan brought me back to life. That's why I'm in this treatment center, because that's how I hit rock bottom. So it's important. But the training needs to include as you are giving people Narcan to use for their loved ones, or giving the police officer to use when they're responding, or a firefighter. And in most of our firehouses, I will tell you, if you go to them around the country, to my colleagues, you will find that there are more runs for heroin and prescription drug overdoses than there are for fires. That's true in my state, and it's probably true in yours. But you need to give them the ability also to tell these people, if you're providing Narcan to somebody, here's the treatment center. It's not enough just to save a life from a tragic occurrence like an overdose. We also have to figure out how not to be, as some firefighters have told me and police officers have told me, saving that life again and again and again, but instead getting these people into the right treatment and recovery program so they can not just have a life saved, but begin to lead a full and productive life. I'm very encouraged by something that just happened yesterday. Stephen Stack, who is the president of the American Medical Association, issued a public letter to physicians. I think this is a major step forward. I don't know Stephen Stack, but I read his letter very carefully because I think he's putting his finger on something that, frankly, the medical profession has been slow to realize. His letter said this: "Far too often, opiate addiction has started from a prescription pad. I call on all physicians to avoid initiating opioids for new patients with chronic non-cancer pain, limit the amount of opioids prescribed for postoperative care, register and use your state drug prescription monitoring program, and reduce the stigma to enable effective and compassionate care." That's a step in the right direction. I hope every physician in the country gets a copy of this letter. We've got incredibly compassionate, caring physicians out there, but we need to face the facts. There has been overprescribing, and that's part of the issue. 4 of the 5 people in my state of Ohio who will die from heroin overdoses over this next month, 4 of the 5 of them will have started with prescription drugs. There is a link here. We need to face it, and the medical profession needs to face it. Again, in the Senate, we have taken action. A 94-to-1 vote is not the typical way things happen around here, as you know. That's highly unusual. That shows the seriousness of this issue. One of the things that I'm concerned about in the alternative to CARA that's being voted on in the House today is it omits some of the key pillars, including a drug take-back program, which I think is important for the reasons we've talked about. Prescription drug monitoring programs. What we have in our legislation is really very simple. It gives incentive grants to states to set up prescription monitoring programs. Most states have them already, but to have them so they work with other states. We need interoperability, as they call it, between the states. In my own state of Ohio, we border many other states, and what they tell me is at the pharmacy we can have this prescription monitoring program for Ohio, but if someone goes over to Kentucky or West Virginia or Pennsylvania or Michigan or Indiana, we don't know. So this is in our legislation. That would help. We hope that's added to the House bill. Prevention, recovery support services. All these are being adopted, I hope, in the House as amendments. If they're not, we're going to work hard to get those included in conference. We're not going to send a bill to the President that's not comprehensive. With regard to prevention, there's some provisions that are omitted from the House alternative, including an awareness program out there nationally to let people know what's going on with prescription drugs and heroin and that connection we talked about a moment ago. That's incredibly important. It will save lives. It will bring people's lives back on track. It will avoid the issue where somebody goes to get his or her wisdom teeth pulled. They're given narcotic pain pills. They end up getting addicted. They end up moving to heroin as a cheaper alternative. And sadly, in some cases, including a father who testified before a congressional committee in Ohio last Friday, a week ago Friday, died of an overdose. That's what's happening out there. So this prevention stuff is important. These prevention grants that we have are important. It's the most effective way to fight back against this epidemic in many respects. Think about it. If you can keep people from getting into the funnel of addiction in the first place, think of the lives that can be saved. The families that can be kept together rather than torn apart. The communities that are not devastated by this spike in crime. the impact on our economy and people not going to work. They say there's a $700 billion impact per year now, economic impact based on addiction. Of course, it's the faces of addiction we care about the most. Think about Marin Riggs from Pinkerton, Ohio. I just learned about her. She was a high school student. She was about to graduate. She was very smart. She had good grades. She was a star athlete. She was popular, full of life, seemed like she had it all. She made a mistake. She tried heroin with her boyfriend. She became addicted. Something changed physiologically in her brain to give her this disease, and it is a disease. Her parents started missing money from their wallets. Charges started showing up on her dad's credit card. She tried to quit. She went into rehab. She wrote in her journal she was heroin's worst enemy. She was going to beat this thing, but she relapsed. The grip of this addiction is horrible. Her brother found her dead of a heroin overdose 2 weeks after her 20th birthday. This can happen to any family, anywhere. It knows no zip code. This is not an inner city problem. It's not a suburban problem. It's not a rural problem. It is everywhere. Addiction doesn't ask what your political party is, by the way, either. That's why we've kept this nonpartisan, not just bipartisan. That's why I hope we can move this legislation quickly to the president and get him to sign it into law, because it's needed right now. And prevention needs to be part of it. Marin's mom, whose name is Heidi, is letting her voice be heard throughout Ohio. She's educating kids and parents about the dangers of experimenting with drugs, and I commend her for that. I'm so grateful for her. And the other moms and dads around Ohio who are doing that, they are amazing. Tonda Ray came to testify here at the Judiciary Committee. Her daughter's name was Holly. Again, she died in her early 20s. She started something called Holly's Song. She's out there talking to people, working with people, families, letting them know what the dangers are, but also letting them know if they have a son or child who's addicted, how to get them into treatment and recovery so that other lives will not be lost. I've heard stories, again, of these teenagers whose wisdom teeth are being taken out and they end up getting addicted to Percocet and Vicodin. Angie Trend is one of them in Lake County. She tells me her son was 16 when he got his wisdom teeth taken out. He's one of the lucky ones. He's now in recovery. He's 25 years old. But the pain and agony that family has gone through from age 16 to 25 could have been avoided. When I think of these stories, I cannot leave out prevention. It has to be part of it. I started my own anti-drug coalition back in my home state, in my home city, about 20 years ago. Continues to be effective today. It's all about prevention, getting the entire community engaged and involved. That's what needs to happen on a national basis, and needs to happen now in order for us to save lives. The approach we took in writing this legislation, the Comprehensive Addiction Recovery Act, was unusual around here. We spent 3 years, as I said, pulling together experts, getting best practices, but also accepting ideas from anywhere where there was a good idea. We didn't care whose idea it was. All we cared is whether it worked or not. I know that these statistics about heroin addiction and overdoses are heartbreaking, and they can be pretty discouraging. But I also know that there is hope, because I've also run into people all over our state who have struggled with addiction, who have found their way to treatment and effective recovery. Usually it's long-term recovery with support from family, from friends, from others who have been through addiction. And they are now back on their feet, and they are now not just productive working members of our communities, but they're helping others. I heard the story of Courtney Golden last week when I was at this conference. She was addicted to oxycodone. She received treatment, has been clean for 7 years. She's now the director of an outpatient counseling center. Heard the story of Terry Skaggs. She's of the Sojourner House in Portsmouth, Ohio. She was addicted for 17 years. But after 17 years, she didn't give up. She's now been clean for 2 years. They beat this, and they're back helping other people. And I see this at every treatment center I go to. There is hope. We can turn the tide. But it does require this institution to pull its act together, to get a good bill out of conference that's comprehensive, it's evidence-based, it's going to make a real difference throughout our communities, and get that to the President for his signature. We've lost more than 7,400 Americans since the Senate passed this legislation on March 10th. Every 12 minutes, we lose another American, as I said, another one of our fellow citizens. Partial solutions will not suffice. We need a comprehensive approach. I will insist on it, as will others. Mr. President, I thank you for the time today. I'm encouraged by what the House is doing today on the floor, and I hope that the next time I come to the floor, I won't be talking about how the House must act, but rather congratulating the House for acting, congratulating the President for signing a legislative initiative that will make a difference in my home state and in our communities all around this country. I yield back my time.